Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us today is the Minister of Health, Tyler Shandro, and Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Minister Shandro will open today's update.
Thanks, Tom, and good afternoon, everyone. Today, I'm here to announce another exciting step in Alberta's COVID-19 vaccine rollout. We've come a long way in a very short period of time. In less than 3 months, we've given out over 266,000 doses of vaccine. About 176,000 Albertans have now been vaccinated, including 90,000 who are now fully immunized with 2 doses. And there's no question, our vaccine distribution system is picking up speed. Yesterday, we provided about 11,000 shots, which is around the average level we'll be working at through March based on the current supply that we are getting from the federal government. And as I said before, we can roll out whatever supply we receive. The only constraint that we have as a province is the supply and the schedule of deliveries. With the vaccine supply finally stabilizing, we're getting doses into the arms of Albertans faster and in larger numbers. Thanks to the hard work of thousands of healthcare workers and the incredible uptake from eligible Albertans, we're now able to announce 2 more steps forward. First, I'm pleased to say that bookings for Phase 2A will begin the week of March 15th. Now, this means that more than 437,000 Albertans between the ages of 65 and 74 will soon be offered the vaccine. To avoid long delays and frustration for those making appointments, we'll be adjusting our approach. So when Phase 2A begins, bookings will start being offered in 2-year age groups. So on the first day, anyone who is between the ages of 73 and 74 will be able to book. And then on the second day, we'll expand eligibility to include anyone in between the ages of 71 and 72, and then so on from there. Staff and residents in senior supportive living facilities who are not already immunized will also be able to book appointments starting on day 1. Appointments will be booked through both participating pharmacies, the online booking tool, as well as HealthLink 811. First Nations, Inuit, and Métis people who are aged 50 and older will also receive the vaccine starting the week of March 15th. Those who are living on reserve will book appointments through First Nations and Inuit Health and their local health centers. Those who are living off reserve will book through either through pharmacies or online. We're finalizing the details, and exact start times will be announced the week of March 15th. Immunizations will begin the same or following day. And it's important to remember that under our system, you never lose eligibility for the vaccine. Once you're eligible, you stay eligible. No one is left behind. I'm also pleased to announce that we'll begin using the AstraZeneca vaccine now that it's been approved. We've just received firm delivery information, so we're planning to offer the first 58,500 doses of the vaccine to eligible Albertans. And as you know, some of those doses are set to expire next month, so we will move quickly. Like the Pfizer and Moderna vaccines, the AstraZeneca vaccine will require 2 doses, but there are a couple of important key differences that will impact how it's used in the province. The AstraZeneca vaccine can be stored at refrigerator temperatures, which means that it can be easier to transport and distribute across the province, especially to areas that are remote or rural. The other difference is who will be eligible for this particular vaccine. In line with the recommendations from the National Advisory Committee on Immunization and other jurisdictions, will be administering, and as well our own provincial advisory committee on vaccines here in Alberta, will be administering the AstraZeneca vaccine only to healthy adults aged 64 and under. Starting on March 10th, we'll be offering the vaccine to Albertans between the ages of 50 and 64 who don't have a severe chronic illness. These Albertans will have a choice. They can book an appointment now for AstraZeneca, or they can wait to receive the Pfizer or Moderna vaccine when phase 2D begins in early May. We're offering AstraZeneca to them because they can benefit the most from these vaccines. And folks in other phase 2 groups are being prioritized for the Pfizer and the Moderna vaccines because of their age, because of their chronic health conditions, or because of their living arrangements. Bookings for AstraZeneca will start on March 10th for any Albertan who was born in 1957. Those born in later years, 1958 through to 1971, will be offered chances to book in the following days as long as supply lasts. I know folks will have many questions about whether they should get the vaccine now or whether they should wait for other options in the months to come. Both Dr. Hinshaw and I recommend that all healthy Albertans get immunized as soon as they are eligible, no matter what vaccine option is provided. AstraZeneca works. It has been shown to reduce infection by 60 to 70% and severe outcomes like hospitalization by 80%. Where this vaccine seems to differ is in preventing asymptomatic infection, which means reducing the spread of COVID-19. That's why we're not using it in any congregate living settings like seniors housing. Getting the COVID-19 vaccine, regardless of the type, is the right choice. It benefits your own health, as well as the health of your family, the health of your community, and all Albertans. The faster that people step up to get vaccinated, the faster we protect our communities and reduce the burden on the healthcare system. The bottom line, widespread vaccination will help all Albertans get back to more normal life sooner. And today's announcement is an exciting step forward and one that should bring hope to us all. With more vaccines coming and the change in second doses that was announced yesterday by Dr. Hinshaw, we now expect to offer all Albertans aged 18 and over a first dose of vaccine by the end of June, provided that, and I should put an asterisk here, provided that the promise of vaccine shipments actually arrive as scheduled, as we were told by the federal government. But let me repeat. By June 30th, we expect to have offered every single adult in the province at least one dose of COVID-19 vaccine. It's an incredible feat, and a lot of work, hard work, lies ahead for us. We'll keep pushing the federal government to actually deliver the vaccines that they have promised, and we'll keep expanding our rollout to get doses into the arms as fast as possible. Now, when I made the first announcement on vaccinations in Alberta back in December, I promised that we get the doses out to Albertans as fast as we get them in. We're keeping that promise thanks to a huge amount of work by AHS and our community partners, the province's pharmacies, and soon our family doctors as well. Now, we're not out of the pandemic yet, but as of today, there is more light at the end of the tunnel. We can see the other side, and if all goes according to plan, we're going to get there faster than we dared to hope, even a few weeks ago. Thank you, and I'll now invite Dr. Hinshaw to provide today's update. Dr. Hinshaw?
Thank you, Minister, and good afternoon, everyone. Over the last 24 hours, we have identified 331 new cases of COVID-19 and completed about 9,500 tests. That puts our positivity rate at about 3.6%. There are currently active alerts or outbreaks in 230 schools, or about 10% of the schools in the province. Currently, these schools have a combined total of 895 cases since January 11th. We have identified 33 new cases of the variant of concern, bringing our total to 541. There are 245 people in hospital, including 47 in the ICU. Sadly, I must announce that 9 new deaths were reported to Alberta Health in the last 24 hours. My condolences go to the family, friends, and loved ones of people who have passed away. Today's announcement about expanding our immunization campaign is great news for our province. Within the next 4 months, all Albertans who want to be vaccinated will receive their first dose, and by this fall, they will be protected with 2 doses. This will make a world of difference in our ongoing battle with COVID-19. I know there are questions about the efficacy of different vaccines, and people are trying to make sense of all the information out there, whether it's coming from the news, social media, or well-meaning family and friends. Even when looking at leading medical sources, it can be daunting to make sense of some of the scientific research, terminology, and data. As always, my goal as Chief Medical Officer of Health for Alberta is to provide Albertans with the facts, information, and data from an evidence-based medical perspective that they need to inform their decisions and actions. Part of the challenge with the vast amount of information out there about these vaccines is that it can be limiting to compare vaccine statistics like efficacy because studies are often done at different times and look at different groups of people or groups of different sizes. It's also challenging because evidence on vaccines evolve over time as we continue to get real-world data from countries that are using these vaccines and monitoring their effectiveness. I want to stress that all the vaccines currently approved for use in Canada will reduce the risk of severe outcomes from COVID-19, including hospitalization and death. All three have passed the rigorous regulatory approval processes in place to ensure they are safe for all Canadians. And all three offer significant levels of protection from the virus. No matter your current age or overall health, I strongly recommend all Albertans are vaccinated against COVID-19 as soon as they are eligible. All three vaccines help protect against serious outcomes or long-term health impacts that COVID-19 can cause for many people. They dramatically reduce the risk of hospitalization and death. And if those reasons don't resonate with you, please know widespread immunization will help us all return to a more normal way of life more quickly. Choosing to be immunized is one of the most important actions we can take for ourselves and for our communities. Finally, I want to take a moment to acknowledge the milestone we will reach tomorrow. March 5th marks 1 year since we identified the first case of COVID-19 in the province. Together, we've navigated the uncertainty of COVID-19 and living in a global pandemic. We've had to find new ways to work, socialize, and look after our health. All while researchers, scientists, and health professionals from around the world have worked to learn as much as they could about this new virus and how best to treat and prevent it. Despite the changes, challenges, and losses we have encountered, we have proven just how resilient Albertans are. Our fight isn't over with COVID-19 because it is still very much in our communities. But we are so much closer to returning to a more normal way of life than we were a year ago or even a few weeks back. We are in a very different place than we were in 1 year ago. We know much more about how the virus spreads, we have much greater testing and contact tracing capacity, and most importantly, we have several good vaccine options that are bringing us closer to being able to successfully take away COVID-19's ability to spread widely. We are close. We just need to keep going until we have widespread immunization. Until that happens for just a few more months, we must continue to act as each other's vaccine. By doing so, we will help to contain the virus and variants of concern. Preventing a third wave in the next few months as we ramp up our immunization program will keep our health system functioning well until we reach our goals. Thank you, and we're happy to take your questions.
All right, we'll go to the phone now for one question and one follow-up each. Operator, could you put through the first caller, please?
Thank you. Kevin Nimick, CTV Calgary.
Hi there. This is a question for, I think, both Dr. Hinshaw and Minister Shandro. There were concerns 2 weeks ago when the booking opened for older Albertans to get their shots, as the online system frequently crashed and froze. What's been changed with the system to be able to handle what I imagine will be a big increase in demand over the next coming weeks?
Sure, and so two different things to talk about, Kevin. One is the phone system, one is the online booking tool. So a bunch of improvements have been made by AHS. One is more lines, one is a dedicated COVID booking phone number, as well as more staff as well for the phone appointments that would be booked. And then for the online booking tool, more has been done to make sure that the amount of servers that are going to be used are scalable for the amount of traffic. A couple of the important things are going to be different, though, in the future with these future groups who are going to be allowed to be able to book their appointments. One is that the community pharmacies are now online. So I know, for example, for my dad had difficulty getting through that day on the 24th, being able to get an appointment through AHS. At the end of the day, though, when the community pharmacies did come online, he was able to get an appointment at a community pharmacy. And so with the added ability for Albertans to be able to schedule their appointments, not just through AHS and their online booking tools, but also through pharmacies that take some of the volume and the stress off the system in that way as well. And so those are some of the improvements that we're going to have. We also, as I announced earlier, if you missed this, Kevin, is that we were going to be having folks booking their appointments in 2-year increments. So the amount of volume will be mitigated to some extent by having, instead of a full range, for example, it was 223,000 people who were eligible and 150,000 of them trying to get through, and having teams of family members calling and using the internet at the same time within that first hour. So that made it a little bit difficult. What we're going to have for these priority groups is starting in 2-year increments, one day at a time, so that we give an opportunity to making sure that people get their appointments as quickly as they can without that frustration. Thanks, Kevin.
Is there a follow-up, Kevin?
Yeah, sure. I'm going to switch the topic a little bit. This one's for Dr. Hinshaw. The NHL has approached the province to explore the possibility of allowing fans into stadiums in Edmonton and Calgary to watch games. Will you offer an exemption to the Flames and the Oilers to hold indoor gathering events in their stadium?
We've had many different stakeholder groups approach us to ask about the timing of allowing fans or spectators for different types of events. And so we are having conversations with many different stakeholder groups about what kind of timing we anticipate that might be possible in, what the requirements would be if that happens sooner versus later. So again, decisions haven't been made because we have to look at all those different factors. But those, of course, are proposals that are part of the larger group of proposals that we're looking at, recognizing that as more vaccines come on board and looking forward and planning forward, we need to be ready for being able to do activities safely that we haven't been able to do for a very long time.
Operator, could you put through the next caller, please?
Yes, Sammy Hudas, Post Media.
Hi there. You outlined a few details regarding the next steps for those who will be vaccinated as more supply becomes available. I'm just wondering where those with developmental disabilities fit into this timeline, as well as their caregivers. I know many groups have asked about where they fit into the schedule and say that they've been left with a lot of uncertainty. So is there any more information to date about that?
Sure. And some of it may depend on whether they also have underlying conditions and would be eligible for phase 2B. But Dr. Hinshaw, if you could speak to Sammy's question.
Absolutely. So we're currently looking at finalizing our list of the conditions that would put people at significantly increased risk of severe outcomes. We're looking at published literature. We're looking at our own data from the past year to understand which of those conditions are those that do pose a significantly higher risk of severe outcomes. And so once that final list is verified, we'll be able to share that. That would be that 2B category. And so again, all of those considerations are underway, and final decisions hopefully will be made relatively soon on that. Caregivers are in phase 2D, and again, we're working to finalize exactly what that means. I know that a lot of people have a lot of questions about what each of those subcategories in 2C particularly mean and how we'll define them, as well as the conditions in 2B. And so expect more information to be coming soon, but we are just working through not only definitions, but also how we validate and how we ensure that we're reaching the right people in those groups.
Is there a follow-up, Sammy?
Right, yeah, just to follow up, when it comes to that information, has that kind of consideration in those decision processes been communicated with various groups who have called for more clarity? Because as they've mentioned, it's not just the issue of when they'll be vaccinated, but they don't even know. They said about a month and a half ago they haven't even heard, any discussion. So has there been increased consultation since then?
The decision-making that we're doing is really based on risk data. And so again, we're looking not just at our own experience and the data from our past year, but we're looking at publications from around the world. We have heard from many, many different stakeholders, and we know that the vaccination program will benefit all Albertans eventually, and we would love to be able to give vaccine to everyone who wants it right now. But unfortunately, with the limited supply, we do have to rely on our data, rely on the evidence about where those risks are of severe outcomes. And that is what's driving those decisions. So we haven't, unfortunately, been able to this point to have lengthy conversations with each one of those different groups who really want more information. We recognize there's a significant demand for that and hope to be able to provide that very soon and acknowledge that it's difficult and frustrating to wait. But unfortunately, that's just not been something that we have been able to do, as we've been really focusing on the evidence analysis and driving forward the opportunities for those who are currently eligible to be immunized.
Operator, could you put through the next caller, please?
Elise Stolte, Edmonton Journal.
Hi, Dr. Hinshaw. My question is a follow-up to Sammy. Specific to caregivers, can you at least say if the caregivers will be limited to the designated caregiver in long-term and supportive care settings, or are you also looking at cocooning vulnerable people in the community?
Those are exactly the kinds of questions that we're just working to finalize. And again, some of the reasons why we've wanted to take the time to get this right is that there have been a few changes that we've announced over the last week with respect to increasing the interval that's been shifting our timing a little bit. We have new vaccines that are being introduced and are being made available. And so we need to consider all of those things as we're working to finalize and then plan for implementation of those different groups. So exactly those questions, again, are what's being discussed, and we don't have final answers yet about which specific individuals will be in that caregiver group.
Follow-up, please.
Yes, there's been some frustration from family and staff at the outbreak at Churchill Manor because staff were not eligible to be vaccinated in Group 1, in Group 1A. Could you tell me when all staff in this type of congregate living center with fragile residents will be eligible, and why weren't they prioritized?
So what we did when we looked at our rollout of vaccination to different groups, we prioritized those where we'd seen the greatest impact with respect to severe illness and death, which is long-term care and supportive living, designated supportive living facilities. And so in those locations, we did offer to residents and staff of all of those locations, focusing on that group in January. And then we were planning to roll out in Phase 1B the residents of those other supportive living facilities. But again, given our vaccine constraints, what we wanted to do was offer all Albertans outside of those very highest risk settings the chance to be immunized when they were personally at the highest risk. So anyone, again, 75 and over, and then the residents of those other congregate living facilities. Staff in those other facilities, so again, we're talking about non-designated supportive living, non-long-term care facilities, those staff are eligible coming up in 2A. So again, that's the March 15th start date that you've just heard about. And the, again, planning that we've done on vaccines, we know that there are many, many groups in this province who will benefit from vaccines, but we have to really make careful decisions about how we offer those limited supplies of the early vaccines to be able to protect those most at risk. And we chose, again, in that 1B rollout to focus on those individuals, again, who are 75 and over and those who are living in those facilities with the intent of protecting those individuals with their personal risk at a high level.
All right, we've got time for 3 more callers. Operator, could you put through the next one, please?
James Keller, Globe and Mail.
Hi, thanks. Just to follow up on that Churchill Manor. So what is the distinction between the long-term care facilities that were included in the first phase and these other facilities that we're talking about that were later on? It seems like one of the distinctions is whether they were publicly funded or not. And I'm wondering if there is any evidence that alone is, changes the risk. I'm just sort of wondering, what makes them different from both the policy perspective and a risk perspective?
Can I start, Dr. Hinshaw, and then I'll let you supplement. I think it's really important for us because our continuing care system is really difficult to understand the full spectrum. There's so many different words that are used to describe different parts of the spectrum. But long-term care is the most intensive side of it. 100% of it is publicly funded. And the reason it's publicly funded is because those folks are the most vulnerable. And because they're the most vulnerable throughout the pandemic, they've been the most at risk of severe outcomes, whether it's death or very serious illness. And so it happens that most of the folks who are the most at risk are going to be in long-term care. As well, we have different distinctions of supportive living. We have designated supportive living, which means publicly funded supportive living. The licensed supportive living is the non-publicly funded supportive living. So, but as it happens that most of the people whose care is publicly funded are the ones who are the most vulnerable in our province. And because they're the most vulnerable, they're the ones we needed to focus our vaccine rollout in phase 1 on those people and the 28,000 residents in DSL and long-term care, as well as those 36,000 employees in there. So that's the distinction. And now we do know that we still, because of age and because of other underlying conditions, people who are 75 and older in congregate living and even in the community in their own homes are also at risk. We did need to focus those first vaccines in phase 1 on the most vulnerable, which happen to be in long-term care and DSL. Dr. Hinshaw, anything else to add to that?
The only thing I'd add is that we recognize that there are some private sites that have a mix of different levels of care. And so the other thing that we did in that first phase is that any sites that had a private operator, but they maybe had some beds, again, that designated supported living status often indicates that individual does require a higher level of care, has more complex needs. And so when there was a location that had some people who were in that category and others who weren't, we did offer vaccine to anyone who was within that group that might be mixing and mingling, whether that was residents or staff, again, to really work to make sure that we were providing it to all those who are at that greatest risk. And as was mentioned, of course, now we're moving on to those other congregate sites, starting first with those residents and then moving within the next couple of weeks to staff in those sites to make sure that everyone has that opportunity to receive immunization.
Is there a follow-up, James?
For sure. And again, just looking at the risk factor, putting that group, including the staff, in sort of the same category as the general public, 75 and up. Again, is there evidence that if you're living in one of these facilities, it's still congregate group living, there's higher risks of getting it. The risk to someone in those facilities, these private facilities, is essentially the same as someone living at home in a private home when they're 75? Or I'm just wondering what they're in the same group, one of them wasn't prioritized ahead of the other, and why is that?
Dr. Hinshaw?
Sure. I'm trying to make sure I understand the question correctly. So just to be clear, we did prioritize everyone 75 and older, no matter where they were living, in that same group. In addition, we did offer vaccine to those sites that had congregate living, not just so where there were sites that had anyone who was 75 and up, we did offer vaccine to all residents in those locations, no matter the age, plus 75 and up in the community, because what we saw from our data was that the risk of death, again, age is one of the most significant drivers. Long-term care residents was an independent risk factor in severe outcomes. We didn't see that same association as we saw with the very high rates of death in long-term care, and then moving into DSL. That same significant increase we weren't seeing in, again, these supportive living facilities, which is why we chose to protect all those who were 75 and up, plus those who lived in those congregate settings with those 75 and up as this next phase. And then staff, again, will be offered immunization within the next few weeks as a part of that 2A group.
Operator, could you put through the next caller, please?
Rick Bell, Calgary Sun.
Good afternoon. A question for Dr. Hinshaw and then a supplementary. I'll try to make it as non-political as possible. What message do you have as the chief public health doctor to those people who are still upset or perturbed about the fact that there was not a full step 2 opening on Monday. People who have complained to their MLAs, and it's even been a subject of discussion in the government. So what is your message to them? What do you tell them? And then I'll have a supplementary. What do you tell those people that are still upset that they didn't get the full step 2 opening?
I would say I can understand why people felt that there was a clear path forward, again, with those hospitalization metrics. I can understand why they would be frustrated and disappointed to not move fully into step 2. I would also say that it's critical that we learn not only from our own experience, but also from experiences of other jurisdictions around the world. And so when we looked at our growth rates and our new daily cases being at about the same place we were at in late October, and we know that in late October, within 6 weeks of that particular point in time, we were sitting at almost 2,000 new cases a day, with our hospitalizations dramatically increasing in the following weeks. So the other piece, of course, I would say is that when we look at the UK, where they had a significant surge in the variant cases, they did move into reopening as they were starting their immunization program, and they saw a massive surge in cases that was so large, their hospitals began to really be pressured by that strain. And so it's incumbent on me as a public health official to give the best advice I can based on our own information, our own data, as well as data that we see from other places about the trends we're starting to see, and to say we need to be cautious and we need to be careful when we're making these steps forward, that we're learning from our own experience and that of others, and that we're continuing to point to our goal of getting to the end of this as fast as possible with as few people dying and as little impact, again, on preventing other people from accessing health care. So things like delayed surgeries and other things that we saw in the winter when we did have that significant surge.
And the supplementary is, let's just fast forward to, let's say, March 22nd, 3 weeks after the Monday announcement. And let's just say hospitalization numbers are about where they are now. And I know this is a hypothetical, but about where they are now, which would put us in, at least superficially, put us in step 3. You might have to deal with this problem again. What do you have? What ends up happening if that happens again? In other words, if we're March 22nd and we're at 250 people in the hospital, people will say, "I guess we're moving to step 3." What assurance do they have that that's going to happen, or is it not going to happen, or is there going to be confusion? Or maybe you could explain that. I know it's a hypothetical, but it could happen.
Absolutely, and we've tried to be clear that there are 2 requirements to be able to move forward in a step. One requirement is that we meet that hospitalization target. The other requirement is that within the 3 weeks between steps, that our leading indicators are stable. And so again, what that means is if we start to see a trend upwards in new cases, in our growth rate, our RT value, or in our positivity rates, essentially what that means is that's an indication of where our hospitalizations will be going in the next 3 to 4 weeks. And so we need to make sure that we don't wait until our hospitalization numbers start to go sideways. We need to be considering the implications of our leading indicators in making any decisions about moving forward. So I think what people need to watch is all of those metrics. They need to be watching hospitalization as well as where our trends go. And what I would say is if people really want to continue moving forward, the best way to make that happen is to continue to follow all of the public health measures to prevent spread in all of the activities that are currently able to be open, because if our leading indicators are stable, then we'll be able to move forward.
Minister has a supplement.
And it's really just to reiterate what Dr. Hinshaw said, Rick, that we've said from the beginning when we announced the Path Forward plan that at each of these steps, it was looking at both the lagging indicator, the hospitalizations, as well as the leading indicators. And so at each of these opportunities, we get to review the data with Dr. Hinshaw and her office and be able to see where our leading indicators are showing any concerns. If they aren't, then we get to move forward with what the hospitalization metric is showing us with each of these steps. If there are concerns with the leading indicators, then we review where are the sources of transmission, where's the concern, and that's what we'll continue to do at each of these considerations, including what you said hypothetically with March 22nd.
Operator, can you put through the final caller, please?
Thank you. The final question is Julia Wong, Global News.
Hi, this first question is for Dr. Hinshaw. A letter from the operator of Churchill Manor told families a couple weeks ago that they were easing restrictions in the facility around indoor gatherings and 50% capacity in the dining room. And they loosened rules even after they found out 2 days later that vaccines were on their way. What's your reaction to their move?
I don't have specific information about what kinds of restrictions were previously in place and the rationale for making that particular switch. I think that in many places across the province, the decline in our new cases, the decline in our cases in continuing care and senior settings, while it's been something we really all should celebrate, perhaps has been interpreted as a sign that we're in the clear. So I really think that what this signals is that the risk is still very much present, and that it's not just incumbent on operators of facilities like this, but on all of us to make sure that we are making decisions in everyday life that aren't just about our own health, it's about the health of the people around us, our family, our friends, but also the people in our communities who we may never meet, but who our actions can profoundly impact. So this particular example is a really good one to remind us that for the next few months, our actions are the key thing that's going to prevent us from causing that spread that can put people at risk.
And just to follow up on that, I guess, what do you have to say to facilities like Churchill Manor in general that have either already loosened their rules or are considering that? And I also want to clarify one point. Minister, you said that bookings would be made per day by 2-year increments. Press release sent out said that it's 1-year increments, so hoping to clarify that with you as well.
What needs to be clarified?
I just wonder, Minister, I think the 1-year increment is for the AstraZeneca and the 2 years for the Moderna Pfizer stage 2A, I believe.
That's correct. I actually couldn't hear Julia's question, but if that was the question, then yes, that's the answer. Thank you, Dr. Hinshaw.
Sorry, I apologize. I didn't realize you're asking for the question. Julia, your question about what I would say to operators of these facilities, I would say 2 things. First of all, we know that vaccine is rolling out right now to residents who live in these facilities. And we also know that vaccine takes 2 to 3 weeks to be effective from that first dose to when it achieves that level of protection that's significant. And so it's really critical that people, not just in these facilities, but anyone who receives immunization, remembers that immediately after receiving that shot, you still need to be just as careful. We also recommend even after that 2 to 3 weeks, because we don't yet know the impact of vaccine on transmission, that you do need to remain cautious and follow all of the public health rules. So again, it's just important to remember that time frame. The second thing I would say is that COVID-19 is still very much in our community. We have many variant cases, and it's really critical to remember that a single infectious individual in a facility where perhaps there's opportunity for it to spread can move very, very quickly and can cause significant spread from one to many in a very short period of time. And it's really critical that we're continuing to follow the measures that are in place until we have enough people vaccinated and enough protection in the community to be able to start easing back.
Thank you all for joining us. Dr. Hinshaw will provide another update on Monday afternoon. Have a safe night.
Thanks, everyone.